98.5% of government funding to mental health is spent on staff emoluments. This was revealed in a report on tracking resources for community-based mental health services by Basic Needs Ghana, an NGO.
The year-long research on tracking resources for community-based mental health services by Basic Needs Ghana was conducted from January to December last year. As part of the research, Basic Needs developed a checklist with health stakeholders with support from Star Ghana in 30 districts of 5 regions in the country. Key findings in the report indicates 97% of funding gap for community-based mental health service. Capacity building stood at 78% and logistics at 96%.
We also found out that the local assemblies are not doing what is needed in order to provide these resources for their people or for the mental health service providers to properly implement services within specific districts. We must understand that that's why traffic keeps building up in the 3 psychiatric hospitals.
Internally generated funds, IGF, was the main mode of financing non-remunerative expenditure. The purpose of the resource tracking exercise was to understand resourcing of community-based mental health care in Ghana. CEO of the Mental Health Authority, Dr. Akwesi Osei, bemoaned the delay in the release of budgetary allocations to the authority and the 3 psychiatric hospitals.
We have had only releases for the first quarter. If you look at the 3 psychiatric hospitals, each one of them should get about 6 million. The government says, no, we can't give you 6 million, but we can give you 1.2 million, that's per hospital. Now the 1.2 million will be coming in 4 quarters, so every quarter will be 300,000. So it's a 300,000 that has been given to the 3 psychiatric hospitals each. The authority itself has had 60,000, which is our allocation, quarterly allocation for the year.
The Executive Director of Basic Needs Ghana, Peter Ayaro, noted mental health remains underserved, adding access to quality community-based mental health, especially in relation to children and women, must be prioritized. The Program Director and Acting CEO of Star Ghana Foundation, Amidu Tanko, expressed disappointment over lack of interest in mental health issues, which has contributed to its funding challenges.
Well, let's stay on this issue, as until the passage of the legislative instrument, the LI, which will support the enforcement of the Mental Health Act, the Mental Health Authority will continue to reel under financial challenges. In an interview with TV3, CEO of the Mental Health Authority, Dr. Akwesi Osei, says the LI is currently with the Attorney General. Here's Wendy Lai's report.
CEO of the Mental Health Authority, Dr. Akwesi Osei, noted the LI is yet to be laid in Parliament.
I just received a letter from the Attorney General that if we are happy with the form in which it is now, then we give them the go-ahead, then they will send to Parliament. So, unlike what I thought was gone, it's not exactly yet gone, but at least it means that it's on its way.
Without its passage, the authority's financial challenges would soar.
And we are hoping that if it goes to Parliament by June, and then when they will be rising after the second sitting or the second session, then it would have been passed. Once that one is done, the next thing will be for the minister responsible for finance to establish the levy for us. Until the levy is established, every time that we get money is just a token.
Meanwhile, Dr. Akwesi Osei is calling on corporate Ghana to support the payment of the toll-free line for the Mental Health Authority to help save lives.
NC has given us that line, but it needs to be activated, and that means that we need to be able to pay for the cost of the free calls that come from patients. The telecos are not picking it. I'm hoping that maybe some corporate body, organization, private organization may come and say that we are going to support you for 1 year, 9,000 a month for 1 year, 108,000 cities. You'll be happy.